Friends, today we will discuss hypersensitivity, classification and type 1 hypersensitivity. Before we proceed to hypersensitivity, let us just have a look at what happens when immune system fails. The first condition in which immune system fails, in which there are deficiency of certain component of immune system, and this will lead to a widespread infection. Body is not able to protect against varieties of infection, and this condition is called as immunodeficiency. In second condition, the immune system mounts antibody response against the self antigen and it destroys the cell and tissue and organs, leading to a condition which is called as autoimmunity. And in third failure, immune system routinely encounters various foreign antigens, but rather than dealing that with normal controlled response, it responds in exaggerated fashion, which leads to hypersensitivity reaction. So, what is hypersensitivity? Hypersensitivity is the injurious consequences in the sensitized host following subsequent contact with specific antigen. Gell and Coombs classified hypersensitivity based on mechanism and the time. According to that, two main classes of hypersensitivity are immediate hypersensitivity and delayed hypersensitivity. Immediate hypersensitivity is mediated by humoral immune response, while delayed hypersensitivity is mediated by cell-mediated immune response. Now, in immediate hypersensitivity, the hypersensitivity type 1, type 2 and type 3 are there, while type 4 hypersensitivity is of delayed hypersensitivity. Now we will discuss type 1 hypersensitivity. It is IgE mediated hypersensitivity. There are two different types of type 1 hypersensitivity. That is localized form, that is called as atopy, and second is systemic form, that is anaphylaxis. When allergen comes into contact with the body part, especially skin or mucosa, there occurs a localized inflammatory reaction, hypersensitivity reaction, and it remains localized, while in other form the immune response is widespread and it involves the whole body, and this is systemic in nature. So localized atopy is localized in form, while anaphylaxis it is systemic in. Very important part of type 1 hypersensitivity is to understand the mechanism of the type 1. So first of all, it is because of some allergen particles which are very well present in nature. So individual, when exposed with such type of allergen particles, now our immune system antigen presenting cells would identify that allergen and would produce immune response. Now this immune response production is of IgE type. So the B cell is getting sensitized, B cell is getting stimulated by helper cell, and now B cell would become a plasma cell which would secrete IgE type of antibody. Now this IgE type of antibody would circulate and would get attached on mast cell. The mast cells have a surface receptors for Fc fragment of immunoglobulin E. So such type of primed mast cells are present in the body in blood and various tissues. Now what happens after some time, the same allergen when encountered again, what happens over here, these mast cells would absorb these allergens, and when that happens, the mast cell will get stimulated, and the stimulation of mast cell would lead to degranulation of mast cell, which will be responsible for various localized and systemic effects because of chemical mediators released by mast cell. So these effects can be systemic or these effects can be local. So now what actually happens in mast cell degranulation? It would release primary mediators and it would release secondary mediators. Chiefly the histamine is there as a primary mediators, while leukotrienes and prostaglandins are there in secondary mediators. Over here we can have a look at this. When this cross-linking of IgE happens with allergen, the mast cell gets stimulated. When mast cell gets stimulated, it will go for degranulation. Now there are certain preformed granules which contains chemical mediators, and these are preformed mediators, which is histamine and proteases along with other chemotactic factors. So these are primary mediators, while mast cell will also generate new mediators. That there are certain cytokines which are secreted, along with there is also some formation of new chemical mediators. Especially these mediators are leukotrienes and prostaglandins. So they are called as secondary mediators. Now we can see over here the secretion of histamine and other mediators would have effect on localized tissue and also in systemic manner various distant organ and tissue. The histamine, you can see over here, will lead to excessive mucus secretion, glandular secretions and tear formation. It can also lead to constriction of smooth muscle, especially of bronchioles, and it will lead to dilatation of smooth muscles of blood vessels. So it will increase the amount of blood flow, but it will decrease the amount of air flow. Very similarly, you can see the leukotriene has got very similar response, where there is a constriction of bronchioles, right? And prostaglandins also, there is a dilatation of blood vessels and constriction of bronchioles. Along with that, it will also stimulate the nerve cells, which will result in a headache. Now there are various allergens present in environment which can lead to type 1 hypersensitivity, like proteins, the foreign serum or vaccines, plant pollens, ryegrass, ragweed, timothy grass, birch tree. Certain drugs can also lead to type 1 hypersensitivity like penicillin, sulfonamide, local anesthetic and salicylate. Food can also lead to localized type 1 hypersensitivity like nut, seafood, egg, peas, beans, even milk. Insect product like bee venom, wasp venom, ant venom, cockroach calyx and dust mite can lead to hypersensitivity. Apart from that, mold spore, animal hair and dander and latex can also lead to type 1 hypersensitivity. Various clinical disease or manifestation which are type 1 hypersensitivity reactions are, as we discussed earlier, can be localized atopy or systemic anaphylaxis. The most common is allergic rhinitis, where individual is susceptible or sensitive to various environmental allergens, and this will lead to a localized reaction, especially involving eye and upper respiratory tract. Another is asthma, where some type of pollens and other allergens can lead to involvement of lower respiratory tract, and usually it is manifested by severe bronchoconstriction. Food allergy is third type, where certain allergens individual is very sensitive to, and when it is ingested will lead to involvement of gastrointestinal tract, leading to either diarrhea or vomiting. Atopic dermatitis, very frequently some type of allergens will lead to involvement of localized reactions on skin. Very similarly, drug allergy can also have involvement of skin. Another type, that is anaphylaxis systemic, where various allergens, when they are introduced into the body, can lead to widespread manifestation involving various organs and systems, leading to multiple organ failure. This is a very fatal condition, and unless treated promptly, this can lead to a mortality. Now we'll discuss various factors which influence type 1 hypersensitivity. Once the most important, the factor which influence is genetic makeup. Individual, because of its genetic inheritance, is susceptible to type 1 hypersensitivity reaction. Another is allergen dose. The smaller dose and repeated dose will lead to IgE type of response, while larger dose can lead to IgG type of response, and much larger dose will be totally ignored by the body. So allergen dose is also very important. Apart from genetic makeup, it is also very important how immune system responds to allergen, Th1 or Th2, right? So over here, there can be inappropriate response against particular antigen, either going into CMI or HI, which is decided by Th1 or Th2, and even that going for IgE type of response is appropriate, but sometimes the individual proceed for IgE type of response, which will lead to allergic reaction. Now we'll discuss the laboratory tests for detection of type 1 hypersensitivity. The first and the foremost is skin prick test. The small amount of antigen or allergen are inoculated on skin by inoculation, and the response is measured. Exaggerated response can very well be noted, and this is how we can identify different allergens responsible for hypersensitivity reaction. Another test is total IgE. It can be identified by various assay like enzyme immunoassay. In patient who is susceptible to type 1 hypersensitivity reaction will have high amount of IgE, but this is not specific. So the third test, we can identify allergen specific immunoglobulin E. Amount of IgE present for a specific allergen would identify the particular allergen responsible for type 1 hypersensitivity reaction. Various methods are available like immunoblot or immunoassay, by which we can identify such type of allergen. So this is all about type 1 hypersensitivity reaction. Thank you.